Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center, coming to you from our South Carolina office today. I was in New Jersey yesterday. This is our latest episode of Dr. Ray TV. It is Friday the 10th and it is about 5:30. All right, so first off, we had a great week between the two offices. Very, very busy, helping a lot of people function and feel better. I want to first thank everyone who referred their friends and family in. Our office is probably about 90%, maybe even a little more referral rate, whether it's direct referrals from our patients or some of the local medical doctors in town. So we're doing our best to get everyone feeling better. So again, thank you. We couldn't be here without you guys, so we appreciate it. Something I wanted to talk to you guys a little bit about tonight is just what type of patients we see and who benefits from chiropractic. And I'm not going to give any names or anything, but I'm going to give the different scenarios that we helped, and maybe these type of things are affecting you or a family member or friend. So we had quite a few new patients. The first couple I want to talk about, we had two different auto patients, so people that were in accidents. And very serious, and they were in some pretty bad accidents, but they did go to an emergency room and they were treated and they had some tests done and released, and they weren't really managed properly. So, and here's where I go, both patients had ACL tears in their knee, so they had a major ligament in their knee, and they were torn. And I guess everybody missed it, whether they didn't run the right test or MRI or what it was, or they didn't do the proper orthopedic test or what was going on. But they both had some pretty bad knee injuries that we had to refer out over to the orthopedics in order to get them fixed up. And they're both going to be a surgical case. So we see a lot of personal injury cases from people that were injured in car accidents. And the key there, or the point to this whole thing, is if you've been in an accident, make sure you get in to see us and let me do a thorough exam on you, get a history of what's happening, and I'll get you to all the right doctors to make sure that everything's okay. So that was that. We had another guy come in, had some severe sciatica, and what that was is he had some really bad low back pain shooting down his leg. He was a former patient of ours, and we hadn't seen him in a while, because most of our patients, we allow them to come in when they're ready and when they want to see us, and he had been feeling well for quite a while, but he did something, and I think he was working when he told me, and felt a pain shooting down his leg and wasn't really sure what to do. And when he came to see us, we did our typical treatment. We took some x-rays, we found out what was going on. We did some spinal manipulative therapy, we did some myofascial work, meaning we worked on his muscles. We iced him, stretched him, and got him to beginning to feel a little better. I ordered an MRI so we could see exactly what's going on with his back. And I also referred him over to Relieve Us, who's a group of pain management doctors in Vineland, and they do a great job about helping people manage their pain. So anytime I have someone that I feel is that flared up and we got the weekend coming, I want to get them better as quickly as possible. So I think chiropractic care in conjunction with some appropriate medical care helps tremendously. All right, so that person was kind of just a back pain patient that kind of came out of nowhere. Is not sure where his pain came from. We had another patient, a young man, and I don't see too many kids. Every once in a while we get some young men in, and he was a very pleasant young man. He was a basketball player, and his mother brought him in, and apparently he's been having some back pain. So here's the thing, and here's to all you parents out there. If young kids and young adults, and this boy was around 12 or 13, they shouldn't have back pain. Okay, that shouldn't be bothering them. So if they're complaining of back pain, or it looks like they're moving around gingerly because their back may be hurting them, or they're not sleeping right, something's going on. Make sure you get in to see us and let's figure out what it is. And with this young man, he had an imbalance of his pelvis. I think he had a dysfunctional lumbar joint. I think he just needed to be stretched out. We need to manipulate the joint, freed up. We had him do some stuff at home and he began to feel better. So again, we don't see a whole lot of kids or younger adults just because I don't, and it's not that chiropractic doesn't help them, I just don't see that many. But if your kids are complaining of pain, chiropractic absolutely is appropriate to get them through this. I had another chronic patient, so someone who's suffering from fibromyalgia, someone who has degenerative joint disease, had some shoulder problems going on, been to a bunch of other doctors. And when I say that, there's probably about 10 or 20 people watching this saying, yeah, that was probably me, because we see so much of it. And I think people with fibromyalgia and people with degenerative joint disease get kind of brushed under the rug, because unless there's one big major thing for the medical doctors to do, they have difficulty managing the pain besides just giving them medicine. So lately I've been seeing more and more of these patients. So if you're suffering from fibromyalgia or a degenerative process, we absolutely can help. And when I'm talking about all these patients, we got everyone to feel better before they were leaving. So I definitely think chiropractic is appropriate for our fibro patients. I had 2 separate patients with shoulder problems, and I don't know what's going on and why everyone's injuring their shoulder so much. And first off, when we do shoulder exams, if I suspect that we have a tear, if I suspect there's an issue inside, we're going to send you out for an MRI and make sure it's something that's not out of my scope, meaning if we have a rotator cuff tear, a labral tear, or some bone spurs or something where I don't believe I can help, I'll definitely get you over to the orthopedic and make sure that they fix you up correctly. So we had 2 shoulder problems. The one problem actually is an adhesive form or frozen shoulder syndrome, and that patient, I think we're going to have to do a manipulation under anesthesia to break up those adhesions to restore that function. So we offer that at Back Pain Relief Center. We had the last patient I want to talk about, chronic neck, low back pain, bilateral shoulder pain, meaning both shoulders, and had been to a bunch of different doctors, been to pain managers, been to orthopedics. Some of them are recommending surgery of her back. And look, there's a time and place for lumbar or cervical surgeries. I would try absolutely everything possible first before you went and made that decision to make the surgery. Now look, if you have a neurological deficit, or we have severe leg pain or arm pain and it's stopping you from sleeping, you can't concentrate and things like that, then surgery may be the option if that's what they're recommending. If we're not quite there yet and they're still offering it, come see me, let me give it a shot, try to restore your biomechanical function conservatively, whether it's in the office or we do a manipulation under anesthesia to get there. But let's try everything before we get the surgeons to cutting on you. All right, I hope that helps everyone. Just a little bit of brief history of the different types of patients we see. And if you have any questions, I'm telling everyone this. Like me on Facebook, whether it's my personal page or business page, I'll friend everyone. If you have a question, message me. I respond to all of them. Sometimes on the weekends it takes me just a little longer to get back. I am with my daughter and my wife on the weekends, and we try to do some fun things. So the weekend's a little longer to get back to you, but otherwise I get back usually within that same day. So I hope everyone's doing well. I know you guys got a little bit of snow up in New Jersey. Hopefully all that stuff is passing through. I know it's a little cooler down here today. So everyone have a good weekend. Stay in and stay warm. I hope all is well, and I'll talk to you soon. Bye-bye.